everyone, and welcome back to my YouTube channel, Once Upon a Molar, where we make learning easy for you. Now, today I'm back with a totally new subject, and yep, you guessed it right. We are now going to be starting our series on oral pathology. And let me tell you this, oral pathology, this is one of my most favorite subjects that I had to learn during my degree. And I'll be very honest, not a lot of people like oral pathology, but I'm really one of those people who actually and absolutely fell in love with the subject. I just found it really interesting, and trust me, if you just know how to tackle it, you're gonna end up loving it as well. So first and foremost, I'm just gonna tell you a brief introduction on how we're gonna do it and what are the pathways that we're gonna be taking. So first, we're gonna be starting off with the books. I'm going to be following the Contemporary Oral and Maxillofacial Pathology, which was my recommended book when I was in my third year, and a little bit of the part and a little bit of the topics that I'm going to be teaching are from Novel Oral and Maxillofacial Pathology. But mainly, we are going to be focusing on the contemporary because I find it that at the third year level, this is the easiest book that you could ever have for oral pathology. It's pictures, scenarios, whatever clinical features or whatever is given in this book. I just found that way more easy as compared to Novel, because I just found Novel to be a little bit on the higher level. But at the same time, for your OSCEs, for your observe stations, you need to focus on the pictures and a little bit of information from Novel as well. Novel is like, how I would say it is that it is like a side book which truly teaches you something interesting which you cannot find anywhere else. Like for my third year, I remember that I read both of these books, as well as whatever lecture notes we were given and whatever lectures we were taught and quizzes and whatever we were assessed on in our third year. But let me tell you, if you know for a fact that you do not like oral pathology right now, I am here to totally change your perception of that. We're just gonna be making short videos from each of the topics. Gonna try making it as interesting as possible. We're gonna be using some mnemonics. We're gonna be looking at some of the notes, and then of course we're gonna have a little bit of quizzes as well. Trust me, I hope that you fall in love with oral pathology by the end of the session as much as I did when I was in third year. Let me tell you, as long as you are interested in learning, there's nothing in the world that can be, that can bother you. You just need to have an open mindset. Don't think that you hate a subject or that a subject hates you. But if a teacher hates you, that's another story. I cannot do anything about that. But trust me, if you are good in oral pathology, your further diagnosis, your clinical practice, your exams, whatever you do, they're going to be really easy for you, okay? So we're gonna be taking everything chapter by chapter, topic by topic. So first of all, we're gonna be starting with the first chapter of the Contemporary of Oral and Maxillofacial Pathology. We're going to be doing the first chapter. We're gonna be starting from the first chapter, which is Developmental Disturbances in the Oral Regions. So one of the most important chapters I would say in oral pathology is the chapter number 1, and give it a read if you have the book. But if you don't want to, don't worry, I got you covered. So we're going to be dividing our topics into teeth, disturbances in the soft tissue, and disturbances in the bone, okay? So we're going to be taking each of them step by step, and I promise you, you will really have fun because oral pathology is really one of a kind of a subject. You will not find another subject in dentistry which is like oral pathology. It is unique on its own. And without further ado, let's get started with our first topic. All right, everyone, so now we'll be starting with our first heading of this topic, which is disturbances in the size. So we're going to be starting with the disturbances in the teeth, and further in that division we're going to be discussing first and foremost the disturbances in size. Now, what we understand by size is that it can increase and it can decrease. Okay, so these are the two variations that you just have to remember, that either the size can increase or either it's going to decrease. If it's going to increase, there's going to be another set of terms that you're going to have to be aware of. If it decreases, there is another set of terms that you have to be aware of, all right? So for now, we're going to be looking at what happens when our size decreases, okay? So now when something decreases, okay, if something is becoming less in size, they usually use the term micro, okay? So the first term that we're going to be looking at correlates with that, which is microdontia. Okay, the easiest thing to remember here, micro means that something is smaller. Okay, and dontia, it is derived from, you could say, it's anything that relates to teeth. Okay, so dontia from, we usually use the term dons for teeth, DONT. So micro, small, dontia teeth means small teeth. That is the literal meaning of the term microdontia. Okay, so as you can see here in the picture, that this is, for example, your normal tooth, and here is a tooth which is affected by microdontia. Yep. So this tooth is going to be small in size as compared to this tooth. Okay. So by definition, it means one or more teeth which is smaller than normal. Okay. So it can, just remember the terms, whatever this, like, even if you want to remember it in like a layman language, just break down the word itself, you're gonna get the definition. Okay, micro, one or more teeth, smaller, micro, teeth, dontia. Okay, so this is the easiest way to remember it, one or more teeth which are smaller than normal. Okay, now it has a few types, okay, which you have to be aware of for your MCQs and all. So it can either be localized, it can be generalized, it can be relative or generalized, and it can be true generalized. Okay, I know there are bit of mixing up, but let's get this started. Okay, so number one, the easiest one, which is localized. Okay, so what do you mean by localization? Localized means something which is restricted to a certain area or something which is less in number. Okay, so by definition, localized microdontia means that if one or two teeth are affected. Okay, if your whole dentition, like let's suppose you have if we don't take the third molars, let's suppose that we have 28 teeth, and out of those 28 teeth, about one or two teeth are smaller than their normal size. Okay, so that is going to be a localized case of microdontia. Okay, so localized if one or two teeth are affected. Okay, as you can see in the diagram, let's suppose this is our upper central incisor, this is the lateral incisor, canine, first premolar and the second premolar. Okay, as you can see just by looking at it, that the lateral incisor seems somewhat smaller as compared to that. We know that in our natural dentition, this tooth is about here. Okay, it has, but right now it has like a weird conical shape. It looks like a cone, like this. Plus, it looks like a cone. If you would just look at that, it kind of looks like a cone, plus it is smaller in size as compared to its counterparts. That is called a peg lateral, which is a very, very common, a very famous tooth, you could say that. It is one of the most affected tooth when it comes to microdontia. Okay, if you ever get like an MCQ or anything that which tooth is most affected by microdontia, you have, if they're asking about the anomaly name, it is called a peg lateral. But if they're asking which tooth, then that is a upper lateral incisor. Okay, here as well we've drawn a lateral incisor, any one or both, that's the main thing. They can be two, they can be one, but usually they are two. Okay, so when you're going to look at the arch, you're going to see two normal looking central incisors, and just along those central incisors you're going to see two cone shaped, conical shaped, as you can see here in the picture. Those lateral incisors are usually smaller in shape, they are pointed, they're like a cone shaped. So those are known as peg laterals, and the most affected tooth in peg laterals are the upper lateral incisors. Okay, just remember that. That is like very important, this term. The other tooth which is most affected by the by the microdontia is the third molars. Usually, the third molars, we all know that they erupt later in life, about 25 years of age, from 20 to 25 years of age, and their bud starts to form later in life, and there's many factors that influences their growth and all. Plus, the size that they have, usually they do not accommodate in that area. So there's multiple factors, but just remember the example if you're ever asked that localized, what tooth could be affected. Lateral incisors for the upper, not the lower arch, and third molars, any of the okay, so when you're going to look at the generalized, the next one that we have is a generalized type. Okay, so what do you understand by generalized? Generalized usually means something that is involving like a larger area, or something which is involving more number of things than the localized one, because localized, you know, it's either one, two things and something which is localized to a certain area. Whereas generalized is usually like something which is involving the whole thing, okay? So what happens is that in generalized microdontia, just remember what is going to happen is that all the teeth in both arches are going to be affected, okay? So you're gonna look at a person's mouth, and there you notice right off the bat that there is something which is fishy about his teeth, and you see that his teeth are very small as compared to a normal adult's, and all of the teeth are affected in both the arches. That is going to be known as your generalized microdontia, okay? Here, as you can see in the picture, this is like, let's suppose this is a normal jaw, and these are teeth that he has, okay? And these teeth are, as you can see, because there's a lot of spacing here, there is a very high chance that these teeth could be way smaller than they normally should be, okay? This is known as generalized microdontia. A term which is very similar to that is relative microdontia, which is also known as relative generalized microdontia, okay? So very similar to the generalized type. The only difference that you have to remember here is that there is a jaw size difference, okay? So what happens in the relative generalized is that you have a person come in and he's complaining, the patient is complaining like, hey, I think I have very small teeth, they don't look good, and this and that. And you look and you examine that patient, because you're a dentist now, and you examine that patient and you're like, okay, I see you measure the teeth and you're like, or you just look at them because you have been through many patients and you're just looking at them, you're like, hold on a second, these teeth are very normal looking, like they look very normal, like and then when you calculate them, their mesiodistal widths, you're like, this is normal. Then where could be the problem? Yep, the problem is probably in his jaw size, that the person has larger jaws, okay? So what happens is that this is very quite difficult to differentiate, okay, but it is not impossible. So just remember that their teeth could be small, it is a generalized type if both the arches are involved. But in the relative size, the jaw size is going to be the problem, okay? The person will have a very large jaw, or they could have a moderately larger jaw than the normal, and the teeth are of normal size, okay? Just remember here that the teeth are normal, but the jaw is big, and the space that the teeth want is way more than they actually require, okay? So there is going to be some spacing here, here. There could be spacing in the anterior teeth, there could be spacing up front here, and the patient's probably complaining that my teeth are small, but the actual problem is that the jaw is bigger, and the patient doesn't usually realize that. And then you have to like tell them that this is the actual problem and the treatment modalities are different. But just remember that in the relative type, there is a discrepancy or increase in the size of the jaw, which is larger, and the teeth are of normal size, okay? Now, moving on to the last term for microdontia, we have true generalized, okay? Now, usually what happens is that there are a few conditions in which the growth is retarded, okay? Like there are many cases of, let's say for example, we have is pituitary dwarfism. Now what happens in pituitary dwarfism is that the pituitary gland, which is basically responsible for the secretion of the growth hormone or somatotrophin, that is depressed. Could be due to any reason, could be a tumor, could be congenital, could be due to removal of the gland, damaging of the gland, anything, okay? Let's say that this little bud, which is very important, which is also known as a master gland, is let's say it is not present, or it has been damaged, or there is a tumor which is pressing up on it, okay? So there is a decreased release of, you guessed it right, growth hormone or somatotrophin. So when the person is going to have a decreased level of this growth hormone, they're going to go directly into dwarfism. Dwarfism is basically, you've probably seen, they're usually, they have short height, and their bone and soft tissues and hair, everything is, it just grows at like a very slow down pace than compared to the normal adult, okay? So these patients or these people are also going to have a small size teeth, okay? So So just remember that, okay? So true generalized means something which is associated with our growth hormone. Just the one condition that we have here is pituitary dwarfism. Then we have localized, generalized, relative, or relative generalized. Doesn't matter which term you use, but you just need to have a good understanding of it. Then we have true generalized, okay? So the, we're just gonna go through this once more, and then you can go and look at the quiz that we have uploaded on our page on YouTube Shorts, and you can go ahead and try answering those questions. I've uploaded those already, okay? Okay, so microdontia, one or more teeth smaller than the normal. It can be localized, it can be generalized, it can be relative generalized, or true generalized. Localized, if one or two teeth are involved, the most famous examples and important ones are peg laterals, which is the upper lateral incisors. Then we have the third molars. Generalized, when all the teeth in both arches are involved, alright? So jaw size is normal, teeth are small, okay? Then we have relative generalized, in which there is no problem with the teeth. The teeth are normal, but your jaw size is larger, okay? Then we have true generalized, which is associated with our growth hormone, okay? And the term that usually, the people who usually have it are those affected by pituitary dwarfism, okay? So there could be a decrease in the size of the teeth, which could lead into true generalized microdontia. I hope this was easy to understand. And now we'll be closing up this lecture here. Don't forget to subscribe, and our next video is going to be on macrodontia, which is going to be a total opposite of microdontia. And if you want to learn that, go ahead and watch that. I promise it's going to be a good one, okay? Okay, goodbye guys.